everyone. I would like to take a few moments to briefly clarify the trajectory of illness assignment, the semester project that you've been working on. This is your most important assignment for this semester, and it is a culmination of the whole different objectives and different things you've learned this semester. And hopefully it will incorporate all of those elements, all of the pieces that we've worked on, and bring together a very fine effort on your part in this final assignment. So I'm inviting you, and I am also strongly encouraging you to work on this assignment over the course of the entire semester. Your readings from the Love&Peace Chronic Illness textbook will align nicely with the content in the weekly course assignments, as well as some of the readings from CREST textbook. And these will help you develop and implement your project. So first of all, I would like you to think about the disease that is of interest to you. And this is a good opportunity for you to work on diseases of areas that are unfamiliar to you in your practice, and stretch yourself a little bit and try something new and learn something new. So I encourage you to think about that, and you could take it as perhaps a personal and professional challenge to yourself. So as you already know, you would have to have already notified me prior to this project as to the specific disease or condition you wanted to focus on in this project. And this really allows for the most variety in presentations so that your peers can learn from your research as well. And more importantly, we can learn how we can educate our patients and family caregivers about a variety of diseases and conditions. So everyone should have a different focus. So the final product is in this assignment has two parts. Part one is a disease-specific research paper, and a complementary educational voice-over PowerPoint would be part two. So part one is a research paper. Part two is the same topic, but in a educational PowerPoint, a voice-over PowerPoint that you would use to educate patients and family caregivers. And so the research paper is going to be a 5 to 8 page double-spaced APA formatted paper with references about your chosen condition or disease for this trajectory of illness assignment. And then you'll have the following, you'll need to include the following subheadings. You'll need an introduction background, then you'll need a body of the paper, which would be focused on the trajectory of illness section. And then finally, following it up with implications and conclusion section. These will be listed specifically in the assignment. So please make sure you look over the assignment instructions carefully so you don't miss any of those parts. This research paper should demonstrate your knowledge that you've gained from the semester, from the modules and the Love&Peace Chronic Illness textbook, as well as the CREST textbook, as well as your knowledge about doing scholarly literature reviews and finding relevant evidence to use when creating a research paper and teaching patients about their illness. It also should demonstrate your knowledge about the role and duties of the geriatric care manager in the context of the patient's illness or condition. Okay, so then again, part two is a voice-over PowerPoint presentation. And this is designed specifically for educating a patient and their family caregivers. So please be wary that this PowerPoint presentation is not a presentation for other healthcare professionals, but it is a presentation that you would use to educate patients and families about their illness or condition so that they can understand the illness and its trajectory, and that this would be informed by the principles of health literacy that you've been learning this semester about how to provide information to patients in a patient-centered, future-focused fashion that addresses their illness in a way that they can understand. So now I want to take this time to present a second option that you may want to consider for this project. So option one, again, is the research paper with a voice-over PowerPoint patient education presentation. But option two is, instead of doing the research paper, I'm going to give you the option to skip the research paper entirely and instead watch the interview with Dr. Farrell that's posted below in this module. You would watch the full length of this video and then answer the following questions in 1 to 3 paragraphs. So there's 8 questions, which are: what are the 4 M's as described by Dr. Farrell? Question 2 is: what model does Dr. Farrell use? when assessing the 4Ms and what matters most to the patient in deciding if they're ready to make a healthcare or lifestyle change. Question 3 would be, what were 2 important considerations Dr. Farrell discussed for transitions of care? 4 would be, what are some characteristics of the excellent care manager that Dr. Farrell discussed? And then number 5 is, in a patient with cognitive impairments, what 2 key principles must be balanced most in determining what matters most to a patient with a cognitive impairment? 6 is, what are the main differences Dr. Farrell discusses about capacity versus competence? 7 is, what is the single most important factor Dr. Farrell identifies to get students involved and interested in geriatric healthcare? And then finally, for question 8, what did Dr. Farrell say is great about working in geriatrics? Now, he mentioned several things, but I want you to name at least one. So that would be the second option. So option 1, again, would be the research paper and a follow-up complimentary patient education voice-over PowerPoint presentation. And then option 2 would be the answer the questions to Dr. Farrell's interview, and then also follow up with the complimentary patient education voice-over PowerPoint. I would encourage you, if you do option 2, to actually really consider some of the things that Dr. Farrell discusses in the interview and how you can involve those in your PowerPoint presentation. Now, the best assignments include the following elements: a very clear and simple description of the illness, simple visual illustrations, and clear illustration that summarizes the trajectory of the illness as it progresses. Let me back up. When I say the very best assignments, I'm talking about the PowerPoint presentation only for this part. But, so please note that the illustration in the PowerPoint is a required element of this assignment. The best assignments would be respectful of the patient and their existing knowledge, as well as their health literacy needs. And then they would be brief and concise, but also engaging. If you want to educate patients and families, you need to present the content in a way that invites them to engage in the content comfortably with the content, and then with full awareness that also what you're telling them probably may have, they may have some reluctance to hear the information at first. So keeping all of those things in mind as you make your presentation. So this assignment is really the culmination of the concepts that you have learned this semester and have addressed over the course, and your opportunity also to demonstrate your ability to communicate as a geriatric care manager in a warm, direct, and effective manner that is client-centered and based on the clients and the family's needs as the geriatric care manager. So I am happy to take any questions you have about this final trajectory of illness assignment, and I'm excited to see what you all come up with. Let me know if you would like to do option 1 or 2. I'm going to send out an announcement that kind of briefly discusses all of what's in this video, but please watch this video so that you can get a clear understanding of the assignments and the options that you have. And I look forward to looking at your assignments and reading them. Thank you.